I remember Nicolette having, first few conversations about what would happen if we had to stay at home.
In the beginning, there was sort of a free-for-all. Nobody knew what was happening.
COVID has been kind of the overarching story.
Kind of fast and furious.
It was a lot. I mean, I came on and they said, can you work weekends? Can you work 60 plus hours a week?
Hurricane season kicked off with a bang and it didn't ever seem to let up.
We have been activated, for the entire country since late January of this year. So that's unprecedented.
I think everybody's really tired.
Well, I'm Courtney.
My name is Edwin.
I'm Kanaya.
I'm Natalie.
My name is Ryan.
My name is Sarah.
My name's Sean.
I'm Summer.
My name's Melanie.
My name is Nicolette.
One of Healthcare Ready's greatest strengths as an organization has always been rooted in the partnerships that we have across federal, state, and local governments, as well as our private sector partners.
And most of our partners, while very interested and focused on these issues, especially during a crisis, simply do not have the bandwidth to go it alone during a disaster.
We have a good understanding of what state and federal and private sector resources and plans could be changed or shaped to influence what happens on the ground.
Making sure everyone is accounted for end to end of the supply chain.
There's millions of supplies. So it's not just one cute little line tracking the literal entire country and then really the globe, because we're thinking about the global supply chain and how that impacts our work.
It was helping make sure that the health and medical donation offers that came into FEMA were routed to the healthcare facilities or even the states or the areas of the country that needed them most.
Small hospital in the middle of Kansas come to us and be like, hey, we are desperate for PPE. We were given your contact information. Can you help us? Yeah, we have 5K masks and 2,000 bottles of hand sanitizer.
INEOS came to us essentially asking for us to support in coordinating the donation and identifying recipients of the hand sanitizer that they were going to produce.
But since they hadn't worked in emergency response before, they didn't know how to reach those hospitals, how to reach those healthcare facilities.
They produced over 20,000 gallons of hand sanitizer.
The work that Sarah has been able to lead with Project Hope, I think, is something that I'm proud of.
It's important to remember that while we're talking about 6.5 million pieces of PPE, we're also talking about lives, missions, livelihoods, and communities that have been supported, not just by the PPE, but also by the relationships that come with those deliveries.
We have a timeline of all the events that we've activated for this year, and it includes earthquakes, wildfires, hurricanes, cyber attacks, pandemics, dust storms.
And oftentimes those exacerbated the existing problems that the pandemic presented.
Whether it be pharmacy closures, anything of that nature, maybe transportation disruption, everyone ramped it up to the next level. They were on top of it. We had multiple situation reports go out that were really beneficial to our private sector partners and government partners as well.
There's so much data, so much data. Everyone's collecting data and everyone's showing data, but it's really important for us to sit and think really critically about what data matters and what data matters to who. And
RX Open, which it shows nationwide what pharmacies are open per refresh, which is every other day. During the height of COVID, it was every day we updated it.
The distribution of pharmaceutical and medical supplies. And it is often one of the reasons why it's so important to think about that is because in disasters, that's what's most likely to be impacted, because you have, road closures or flooding or just facility damage.
We've begun building maps that will be shared early next year that can really highlight what counties are most at risk and also least able to deal with that risk should it come to pass.
we work a lot on community resilience and trying to figure out what makes a community resilient versus what makes a community vulnerable. And that's always been something we've done, but I almost feel like it's picked up in the last year because we're seeing so many vulnerabilities come to the fore.
An important development that the organization had this year was really strengthening not just our data analysis capabilities, but our data visualization and that impact analysis.
So I think being able to really focus and talk about the impact of COVID in Black and Brown communities and really thinking about that and being able to really explicitly name it in our work.
Seeing that we were able to still do that even with COVID and hurricanes and wildfires and everything else going on this year is something that I'm really proud of, and I'm excited to continue to see our organization build